Hi everyone, and welcome to today's podcast. I'm Maddie Fowler, your host for today, and we'll be discussing medical disparities for people on the autism spectrum. Medical encounters can oftentimes be more difficult for people with autism due to ingrained social bias in healthcare providers, as well as structural barriers within a hospital or clinic. According to recent studies, patients with autism are less likely to be believed and less likely to experience trust and support from their physicians. These inequalities may contribute to the increased health problems shown for people with autism, and these disparities are even worse for people of intersectional minority identities. Today we speak with Eli Ojo, a 19-year-old with autism from Chapel Hill, North Carolina, who has extensive experience with the medical and surgical settings. We welcome him today to our podcast.
All right, Eli, thanks for agreeing to talk with me. And to start out, I want to ask, do you identify as having any disabilities, and what would those be?
Yeah, I've had an autism diagnosis since I was 2, and then I have CP, which is basically muscle tightness in my legs, and then anxiety.
Okay. And regarding your medical treatment and autism, are there any specific instances in which physicians' personal assumptions about autism have affected your own medical treatment?
Yeah, I could think of a few examples. Like, for example, my pediatrician still talks to me like he thinks I'm in kindergarten. I mean, I don't know. He's good at his job, but it's kind of annoying. It kind of makes it feel like that you're being treated like, a child.
Wow.
What Eli's describing here is a pretty common problem for a lot of people with autism. Many people report problems with communication with their physicians, whether that being treated like a child or not being able to understand the physician due to the use of too many figures of speech or too much obscure medical language. Let's listen to an example.
A G-tube consists of a piece of soft plastic that is surgically introduced into the stomach across the wall of the abdomen. It is generally surgically sutured into place and can stay in place for months or even permanently.
Medical jargon like this is very common and impacts the experience of many patients, not just those with autism. But now, let's get back to the interview.
And this kind of relates to what you said earlier, but would you have any more details about have physicians ever questioned your credibility or the credibility of your parents or your caregivers, those around you?
Yes. I had a hospital stay in 2013 and had to have a GI hernia repaired, and basically after that I wasn't able to get anything down by mouth, and so I tried to tell the nurses on the floor and the doctors that were treating me, hey, I can't drink or eat anything right now, and they kept pushing and Mom kept reiterating, but somehow they thought, of course I couldn't have this idea on my own. No, my mom was somehow manipulating me to say this and just didn't want me to eat for some reason. And so literally what they did was they waited until my aunt came to relieve her, so that she could, get some rest. And then while she wasn't there, then they went in and literally asked me, is your mom telling you not to eat?
Oh my God.
You should be eating. And I tried to say, like, no, believe me, I want to be able to eat. I just can't. It's not going down. And they wouldn't listen. Like, literally, basically they were ready to shove us out the door for just being difficult. And so they basically said, okay, we'll flush him with, like, IV fluids and as much formula as we possibly can, and then just send him home. We went a few months later to Children's Hospital Philadelphia, and come to find out the nerves from having so many surgeries were not firing all the time. So basically I can swallow some, but not always. And so yes, I was absolutely right.
Wow.
It was ridiculous. Granted, that was a crazy circumstance. Like on Easter, the main surgeon person wasn't there, but it was still ridiculous.
Wow.
To have to go through that and really dehumanizing.
Oh my gosh. So, have physicians ever offered accommodations to make this experience more rewarding?
You know, they have. I will say the Peds GI is great at UNC at accommodating. Like, they've known us and have followed us for years, and so they've been great about letting me follow a routine. I've come up with one that works like... This took years of trying to figure out exactly what specifically was bothering me, because for years I couldn't put this into words. But come to find out, there were things like, for example, the smells of the hospital were bothering me. So I'll bring like a can of coffee beans to smell, or the smell of the actual gas that is inside the mask they use to put you to sleep was bothering me. So I would put, like, there's a lip balm that I like that they will put in the mask for me so that it doesn't smell bad, just things like that.
Wow.
So yeah, they've been really good about the routine, and I'll just go back there with Mom and she'll hold my hand and we'll count as I listen to music, and yeah, that seems to work every time, and they've been great about that.
Great. So, you mentioned having a routine. Is that something that is pretty significant in helping you to...
Oh, it's huge, not just with Vijitsu, but I think with any medical procedure or just anything in life for a person on the autism spectrum. Having a routine and knowing what to expect as much as possible is huge, and so I think it would be a great resource for hospitals to have this very detailed list of 1, 2, 3, the different steps to all of these procedures to hand out to folks on the autism spectrum, just so that it's very clear right from the get-go, this is what's going to happen, and then also saying, okay, now we're moving to step 2, now we're moving to step 3, just so it's very clear, because I've had people, like, try to hold me down to do medical procedures, like if I need to get blood drawn or something like that, and that, if you've ever had that done, is difficult enough.
Oh my gosh.
Yes. I've had some horror stories. But yeah.
Wow. Thanks so much for talking to me, Eli, and it sounds like you have some really great ideas on how medical practice could be improved.
Well, Eli's story is definitely unique. He gives important insight to some common medical barriers for many people on the spectrum. It's important to recognize that stereotypically objective jobs like medicine are not immune to social stigma. Preliminary research about autism trainings for healthcare professionals has shown promising results for both doctors and patients, and it could be an important first step. Thank you all for listening to today's podcast. I'm Maddie Fowler, and we'll see you next time.